Because it's only Thursday. We are now live. This is Senate Health and Welfare. It is Thursday, April 23rd. And we are taking up for the next hour and a half. We're going to be looking at H 938. We've taken testimony from folks who've been principally involved in this bill right along, and we understand that the bill has come over with sort of the balance of support and lack of support, typical of a large bill like this. We've been through this discussion previously with S91, and we know that there are a lot of issues embedded in this one bill. So Katie, what I'm going to ask of you is to begin helping us walk through the bill slowly, it's at a medium level, so that we can understand what exactly is here again. And we can start considering asking questions for purposes of markup. And I know we've heard from folks who want us to make big changes, and there's the folks who want us to make little changes. So any of those things that you have in mind as we're going through, we have a list of things from the books. We can stop and ask those questions. This is the first day that we're doing this. Next week, we'll be doing it again and again until we've gotten through the entire bill with our questions and answers and our decisions. So we don't have the luxury of time that exists upstairs. They have a different time machine here. So we're going to do what we can do with alacrity, which is a process. So I'll turn it over to you, Kate. Thank you.
All right. Good morning. Katie McFerrin, Office of Legislative Counsel. Here is our as passed version by the House, H 938. So our first section is the findings section. And we have two findings here.
So, and you know what? We haven't ever been through the findings or the intent.
Okay.
And I'm asking the committee, do you want to do that, to go through the findings and intent? Good point. Want to go through the intent? The findings are short.
Okay. So I'll go over the findings also.
Yeah.
Okay. General Assembly finds that first, although an imperfect tool for measuring the true number of unhoused Vermonters, Vermont Homeless Management Information System, as of December 2025, indicated that there were 4,022 individuals who are homeless in the state, 863 of whom were children under 18 years of age. And second, the 2024 Vermont Housing Needs Assessment notes that of the 36,000 primary homes needed in Vermont between 2025 and 2029, the number needed to address homelessness is 3,295.
And economic development and natural resources have been working on opening the pathway for housing, and we're helpful in here as well with some of the work that we've done. Okay, go ahead.
Okay, next is the legislative intent section. So we have a list here. So the intent of the General Assembly that unsheltered homelessness be eliminated, and that homelessness be in Vermont be rare, brief, and non-reoccurring. That Vermont reduce reliance on the inefficient use of hotels and motels for emergency housing. Top of page 2, that utilization of an emergency housing benefit to access hotels and motels through the General Assistance Program end and be replaced by a continuum of services. And a continuum of supports and services be available to provide a stable pathway to permanent housing that meets the specific needs of households experiencing homelessness.
So as we're going through, if you want to stop, just ask Katie a question and go right ahead.
Okay. So then we have our purpose section. Again, we have a list here. The purpose of the act to establish a continuum of supports and services for households who are experiencing homelessness or who are at risk of experiencing homelessness. Ensure that tailored temporary emergency housing assistance is available to Vermonters in a manner that encourages efficient and accountable use of taxpayer funds. Support self-sufficiency and reduce returns to homelessness by developing personalized housing plans with required participation by households. Establish clear eligibility criteria and require active household participation. expand the use of alternative emergency housing models in partnership with municipalities, nonprofit community-based providers, and private landlords. Then integrate supportive services to assist households to achieve permanent housing stability. Establish transparent accountability measures supporting requirements and oversight mechanisms. Increase program efficiency and promote maximum flexibility in administering services and supports in the continuum. Empower local communities to administer emergency housing services with maximum flexibility, and create a diversified system of emergency housing options, including shelters, specialized shelters, shared housing arrangements, post-home models, master lease units, and rapid rehousing placements to provide cost-effective, sustainable, and supportive outcomes to households.
Okay, stop right here. Any questions on purpose? All right,
Okay.
but when we finish the bill, we might come back and decide it needs to be changed, but.
So then chapter 4 is where we create section 4 is where we create our new chapter in the Green Books, and Title 33 that creates the Vermont Homelessness Response Continuum. We have a definition section to start. I'll move through this. I know we went through some
Well,
of
there
the.
are some definitions in there that we may want to discuss.
Okay,
So just briefly go through each one and we can stop. I have a question though.
okay. Alternative housing options means housing options including shelters, specialized shelters, transitional housing, recovery residences, shared housing arrangements, post-home models, master lease units, and rapid rehousing placements. Applicant means the household that applies for emergency housing assistance. At risk of homelessness means precariously housed without sufficient income, resources, or support to prevent homelessness. Case management services means individualized supportive services. Coordinated entry means a process that standardizes the way households at risk of homelessness or experiencing homelessness access and are assessed for and referred to the housing and services that a household needs for housing stability. Department means DCF. Disability means physical, sensory, cognitive development, or mental health condition or substance use disorder that substantially limits one or more major life activities, or that requires ongoing support, accommodation, or treatment to maintain the individual's health, safety, or independence. The term includes chronic or episodic conditions that significantly impact daily functioning, regardless of whether the individual is receiving or is eligible to receive federal disability benefits.
So this is what the one in particular to look at.
Mhm.
And so this is a definition of disability. Is it the same definition of disability that we use when people apply for disability, for eligibility for disability services overall?
I'm not sure. I don't know.
Yes, I'm looking back and seeing it.
No,
So it's not the same definition. Is it confusing to have this definition and then the same, and then another definition for disability? I'm wondering if we call it something else, like a personal need. I don't know if this was discussed upstairs or not. Looking at Commissioner Hoffman.
yes, it was discussed upstairs and they went with this definition. This isn't something that we have a recommendation to change the language.
You change the entire language
Mhm.
or to change the title,
The definition.
the total definition, but it's
Yes,
still a disability. I mean,
Yes.
everyone who seeks homelessness doesn't have a disability. Oh, everyone who's homeless doesn't have a disability, but they might not have the resources to support themselves adequately. They might be working 3 jobs. They can't afford to find a place to live. So my concern is defining that person as someone who's disabled. Economic disability, I don't know how to get there.
Isn't the solution something like 15% are working?
Pardon me?
there is a statistic.
Yeah, we have data that the
Yeah.
people who are
Percentage
that
that
are homeless are working. That's why I brought that up. And I'm trying to understand. Before we get embedded into that definition, because there's a whole bunch of things in there. I'm trying to understand what we might call this besides a disability. So there are people who are disabled who are homeless, and they're part of the process for having them apply and be part of the system. I don't know if anybody else on the committee feels the way I do. Go ahead.
No, I think this, to me, this is a very comprehensive definition of disability that is appropriate for this big impactful bill. That's my opinion. You're right, it doesn't, homelessness isn't embedded in the definition, but we know that a lot of folks who are homeless are disabled.
So, Madam Chair, if they're receiving Social Security disability benefits, they've had to have reached a certain definition of disability at the federal level. So I would like to see the difference between the federal definition of disability and this.
But that's what we're talking about here, isn't that federal disability?
I understand
Yeah.
that. I understand.
Yeah. So what we're trying to do is to discriminate between that definition and this definition.
Well, do we have a Vermont definition of disability?
We use the ADA definition, and I think that's our recommendation to put into the bill. And I'm not really sure I understand why there has to be a distinction of disability specific to homelessness. The way the disability is used throughout this bill is that it expands who's eligible, and it also can negate the requirement for participation based on a disability. The disability as defined here would be really broad.
I understand that. So my question is it meant to be broad? Is it meant to be
No.
something beside disability? And then there's a separate disability that's ADA compliant.
Yes.
So this definition for me captures all the people who might be accommodated through this continuum of care. So that kind of defines the people for me. And I might be missing something as we go forward. I think it's sort of a catch-all for all folks who are later on described in the bill. The services are often the places where they may stay. And then the question that Senator Morley's brought up about the federal definition for disability, which is very discrete and offers a different level of support because of the federal law and where we are in this state. So that's just a question I have. We don't have to solve a problem now, but I have my little flag.
Yeah, I just think if our goal is to house as many people as possible, why wouldn't we have the most broad definition that we can have?
Okay, so let's. So I have
Questions?
What if you did targeted, what if you defined it as targeted population? So this is the group that and then expand it to include those who have financial distress. So you include that, but that's your targeted population for the continuum, but disability remains the same disability definition that we use in other programs.
Well, that's a question that I have. And so, and I know that, so Brenda, you wanted to make a comment.
I did. Brenda Siegel, and Homelessness Vermont, for the record. The disability of definition that Kate was come up with in upstairs, was we had sent in one recommendation from Disability Rights and from, the Vermont Center for Independent Living. I'll send that to y'all as well. But they came up with that they felt was closest to the ADA definition. So this federal disability they felt was closest to the ADA definition. I would have used the ADA definition, and it's fuller the recommendation of them. But I will say that SSDI and SSI definition is completely different. It's about whether or not you can work. And I would want that to be the definition because
Okay.
that disincentivizes.
We understand.
Yeah.
Yeah, no, exactly. That was my point that I was making earlier. So what we might want to do is to figure out how to discriminate between
Mhm.
all this whole group that's here and then the other folks who are disabled. Difference. Just because you can't meet your economic needs doesn't mean you're disabled. Yeah, so anyway, so let's scoot along. So I just, that one's been bugging me since I first saw the bill. Put it out for discussion, and any help we can get would be terrific. Okay, so go ahead.
Okay. Diversion in strategy aimed at preventing homelessness by helping households find immediate alternative housing options instead of entering shelters. Diversion focuses on addressing the needs of those who have recently lost their housing. Eligible household means a household that is homeless and is physically present and intends to reside in Vermont, as evidenced by active participation in housing, employment, and other AHS recognized plan. Another AHS recognized plan. Emergency cold weather shelter means publicly funded shelter beds made available to households during periods when the National Weather Service is forecasting temperatures at or below 10 degrees Fahrenheit, including wind chill for a majority of the state. Emergency housing means temporary shelter, lodging, or other housing support or related services provided to eligible households to protect the health, safety, and welfare of eligible households when no safe housing option is immediately available. Highly structured shelter means a shelter that provides programming that emphasizes case management, housing, stability, employment, education, or treatment services, as well as other services as appropriate in a manner that accommodates an eligible household's disability, if any. Homeless means lacking a fixed, regular, and adequate nighttime residence, facing imminent loss of primary nighttime residence, fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions that relate to violence against a household or household member that either takes place in the primary nighttime residence or causes the household or household member to be afraid to return to the primary nighttime residence. Residing in a place not meant for human habitation such as cars, parks, abandoned buildings, or streets, or otherwise defined as homeless under federal law.
Do we have what? Well, I underline that because I just don't know what the federal law said. We'll deal with that. I'll just, it keeps changing, and as long as it doesn't negate what we've been doing in the state. If they use the National Guard. Yeah. Anyway, that's federal law. Commissioner, not doing that. Okay.
Household means an individual or group of individuals with or without children, including individuals who reside together as one economic unit, who are married, parties to a civil union, or unmarried. Low barrier shelter means a shelter that minimizes barriers to entry by reducing the rules and programmatic requirements found in highly structured shelters, while still providing case management or other housing support services in a manner that accommodates an eligible household's disability, if any.
So I'm gonna have you keep going, but I'm just, for all of this section, we're asking to have rules written later on in the bill, both emergency rules.
Mhm.
Yeah, right, within a short period of time, which can't happen. And then, long-term rules. So a lot of these things will be elaborated on. Or will make, I don't know. Could be, the federal law piece, that's, I'm going back now.
Okay, top of page 7, minor child means an individual under 18 years of age, office means OEO, permanent supportive housing means long-term housing with wraparound services for individuals with complex health and social needs. Prevention means services intended to prevent a household from becoming homeless including housing relocation or stabilization services, or short-term rental assistance, including rental arrearage. Program means the continuum. Rapid rehousing means short to medium-term rental assistance and supportive services aimed at assisting a household to quickly exit homelessness. Shelter means a facility that meets the department shelter standards. Specialized shelter means a facility that meets the department shelter standards and applicable standards for the delivery of additional services, including healthcare, mental health services, or services related to substance use disorder. Supportive services means individualized supports to assist a household in obtaining and maintaining housing, including intake assessment and services for diversion and homelessness, household need assessments, case management, individualized household plans to address identified needs, housing navigation services, assistance obtaining and retaining housing, including financial assistance, landlord tenant outreach, education, and conflict resolution. Navigation of other services and supports is identified in the household's housing plan, including economic benefits, peer supported services, job training and employment services, services related to disability and independent living, advocacy, and referral to healthcare assistance, including treatment for mental health conditions and substance use disorder. Progress monitoring of interventions and services to ensure continuity after permanent placement.
So let's stop there for a minute, take a big breath with that one. It's a lot. I think that we'll probably, as we go through the bill, I know we'll be coming back and looking at that. So I have I have two questions to think about as we go through the entire bill. One is something we'll look at a little bit later, and that is the funding piece. How much does it cost for each of the things that we're asking to be done in the bill? And I asked that up front because I'm looking at the rate that's there's a lot of money in here. And then how do we appropriate that money? We have the authority in this room to shift the money from one place to another. This is just a heads up for everyone. But we can't change the bottom line. So if it's $21 million, we can't shift that, and we're not changing the GA. So please help us think through that. How many people need what, and where does that money best serve folks? That's my first sort of general, as we're going through the bill, question. The other thing is, now as we're talking about DCF providing services and helping people through these difficult times and to move them away from homelessness. The question was, if someone, could be a philosophical question, could be rhetorical, or it could be something that's very upsetting to all of us. So does the person who is then applying for services and gaining services in this program that we're setting up, would they be under the custody of DCF? That's a general question, because it sets up a different perspective as to how the person is provided services. So the answer is, we need to hear that. So they're not under the custody of DCF, but they're being supported by DCF, and we're setting up a program that maintains their autonomy, but at the same time allows for them to progress through a series of whatever supports are available. So I think we need to be kind of clear about that, because we've had comments, in particular from the ACLU, saying that people are giving up their autonomy. And I don't see that as I go through the bill. I see an opportunity to help people. So I raise that now because we're going to keep hearing about what should and should not be said about people. And then I also think that as we're going through the bill, we need to have some sensitivity about the language that might imply any kind of control. Because I see that there are people who are very concerned about that, whether it's autonomy or control. So just raising it as an issue, don't need to get bogged down into that. But it is an underlying crippling issue that goes on. I have to bring up these things because they bug me. Okay. All right. So I did that with all of that. definition. Go ahead.
Okay. Unsheltered homelessness means sleeping in a location not designed for not designed for or ordinarily used as a regular sleeping accommodation, including cars, parks, abandoned buildings, or streets. That brings us to the top of page 9, and this is where the continuum itself is established. It's established to create an array of services that prevent and address homelessness in Vermont. The program is administered by OEO. Subsection B, the office is to maintain a continuum that is flexible, housing focused, and designed to prevent homelessness whenever possible. The continuum shall prioritize early intervention, rapid resolution of housing crises, and equitable access to emergency and permanent housing.
Okay, I won't bring up that phrase. Equitable access. Okay, we'll keep going. Come back to that one, but you think about it.
Okay. The program shall provide temporary emergency housing to eligible households experiencing homelessness or at imminent risk of homelessness. Reduce reliance on hotels and motels for emergency assistance. Expand the use of alternative housing options in partnership with community organizations, municipalities, and private landlords. Integrate case management and individualized housing plans into all emergency housing placements, and ensure accountability, transparency, and cost efficiency in the use of public funds. And then we have the program components. This is a list you have seen before and is repeated. So we have our prevention services, various types of shelter services, specialized shelter services, permanent supportive housing services, hotels and motels, and other emergency housing services.
I know some people are very concerned about the levels and how people progress through level. For me, it just is a definition of the services that are out there. And making sure that people access and have access to what they need. That's another philosophical.
In subsection B, the office is to address each of the services up above in a separate line item in its budget. The department is responsible for any transfers to other AHS departments necessary to implement the services listed in subsection A of this section. The department and other departments within the agency shall maximize federal receipts as applicable for services listed in subsection A. Subsection C, upon assessing the household's needs, the office or community partners is to place the household in the appropriate level of care to address the household's specific needs.
So does that phrase "shall place" cause consternation? I think that's where some folks are feeling that people are being pushed into one place or another. But if you offer them that and they don't take it, it's still out on the street, but you know you've got services available to them. You know, you say, this is where you can go, and this is what we have for you. No one is picking them up and putting them there. This is what we have for you. And if they say, well, I want to go to a hotel, but they're not available for you at this time. So that's the level, I think that's the concern that people are having about the question of autonomy. We're trying to design something that fits the needs of people, period. And it's not, you can't just walk in and say, I'm staying at the hotel. You know, it's an unfortunate way to be, but we don't have the resources to do everything that everybody wants all the time. So we're providing the right kind of service at the right time for people. Right place. I mean, so that's, I think that's some of the phraseology that might be pushing that thing. So
What if it were to say shall offer a placement?
I would say, let's do that.
Yeah.
Let's change that. That's the one. Yeah. Because then you're placing the household. You just pick them up and put them there. But I'd rather just do what you said, Katie. That's great.
Okay.
Okay.
I think there's kind of two pieces in that. I mean, there's pushing people to some of these they need. but there's also, we may not even have the availability
Yeah.
of the play.
Or the staff.
For the, so it's creating an expectation that can't be met because it doesn't even exist.
And it's a chef.
Of course, so we kind of got to give some flexibility in the way that.
Still see that there was option, most appropriate option available.
Yeah.
Or it goes.
Well, they've assessed the needs and it's in the appropriate level here. So we've offered.
That just need an apartment. You might just not have.
Yeah. So what did we say, Phoebe? What did you say?
Shall offer.
Shall offer to place the household in the appropriate level of care.
Yeah, I like that.
Available.
Well, that's all part of it. Yeah, we don't need to, we'd have to qualify that every time. Oh, is if available appropriate here? I think it's probably not because of how.
Does the law say that you have to place me in the appropriate level of care?
Oh dear. So Katie, they like Senator Cummings has raised a crucial issue.
So you have language throughout, this is to the extent funds exist.
Yeah.
Which is different,
Okay.
but that's different than
Different.
to the extent there's a space available at this
Yeah.
location. I could write something that says to the extent, you have to the extent that I can't come up with words right on the spot, but I understand the concept and I will put something in.
Okay. Good thing you're on this committee. All right.
Okay. Page 11. So this is level 1, prevention and diversion services. They shall function as the primary entry point to the continuum for all households, although connection may be made at any level. The office is to ensure that prevention and diversion services are provided through an agreement with one or more community partners in each region of the state in a manner that accommodates an eligible household's disability, if any. All households, upon request for assistance, shall receive a brief standardized initial prevention and diversion assessment to identify safe alternatives to homelessness and resolve immediate housing barriers. Subdivision 2, prevention includes activities to avert entry into homelessness. Diversion includes problem-solving interventions and supports that safely resolve housing crisis without the use of shelter or hotel placements. Funds administered for prevention and diversion services shall have maximum flexibility. Sorry, I'm tripping over my words. I do wonder in that subdivision 2, everywhere else when we talk about hotels, we talk about hotels and motels, and I'm not sure why it's only one there. Would you be comfortable saying without the use of shelter or hotel or motel placements?
Yeah.
So it's
Yeah.
consistent. Okay. 2205, this is the shelter services broken into 2 parts. So first, the highly structured shelter services. To the extent of funds are appropriated for this purpose, the office shall determine the need for highly structured shelter services and develop sufficient highly structured shelter beds to address that need. The department through the office shall enter into agreements with community partners for the provision of highly structured shelter services for a period of not less than 2 years at a time. Oh, you had flagged this, that it was confusing to you.
Yes.
This subdivision A1. So I'm wondering if you want to think about another way to sort of convey this concept. So that the department through the office is entering into agreements with the community partners for these highly structured shelter services for a period of not less than 2 years. So I think it had been read by some members of the committee to mean that the individual was entering the shelter for that length of time, which is not what the conversation indicated upstairs. If you'd like, I can flag that and try to come back.
Yeah, please do.
Language
Remember
that
conversation. Yeah.
cleans that up.
Yeah.
Okay, and we have that again in the next.
And it's over
That's
the
actually-
next page, right?
Yeah, we have it twice. Okay, subdivision 2, highly structured shelter services shall provide programming that emphasizes case management housing stability, employment, education, or treatment services, as well as other services as appropriate in a manner that accommodates an eligible household's disability, if any. Eligible households receiving highly structured shelter services shall participate in case management and other services to the extent the eligible households, to the extent of their ability. We have language that the office is to ensure that these shelter services meet the Vermont Fire and Building Safety Code. And then we have language that is repeated, throughout the next few sections that say if an eligible household's needs cannot be met in level 1, prevention and diversion, then highly structured shelter services are the preferred initial placement if capacity, staffing, and geographic accessibility are available. Oh, that's the language I'm gonna use.
That's it. So just, I think what we'll do, Katie, is after we go through all the levels.
Yep.
Then we can go back and kind of get the general sense of what each level is.
Okay. Level 2B, this is a low barrier shelter services. To the extent funds are appropriated for this purpose, the office shall determine the need for low barrier shelter services and develop sufficient low barrier shelter services to address that need. The department, through the office, shall enter into agreements with community partners for the provision of low barrier shelters for a period of not less than 2 years at a time. Low barrier shelters,
This is where the language also needs to be.
yeah,
Yeah,
Thank you.
okay.
yeah. These services shall minimize barriers to entry by reducing the rules and programmatic requirements found in highly structured shelter services, while still providing case management and other housing support services in a manner that accommodates an eligible household's disability, if any. Stays in low barrier shelters shall be time limited, and eligible households shall be transitioned to highly structured shelter services or permanent housing as soon as feasible. We have the same language about the Vermont Fire and Building Safety Code, and then this language again, that if a household's needs cannot be met in level 1 or the highly structured shelter services, low barrier shelter services are the next option.
And this, we're not doing this right away. I mean, there's a 2-year process for sending all this to ODO, or there's a 2 years process.
Yeah, I do.
So, see.
Don't get enough hot wax.
Yeah,
What?
I am too. There's a smell in the room.
Oh, maybe can we open that door? Can we turn that thing on, John?
It is on.
It's, just turn it off, right?
Smells like
That's all. Yeah.
John, last time we abandoned the building, somebody put a plastic spoon. It smells of bad. What are you doing over there, Sharon?
Nothing. This is awful, guys. The charger is on. It's turned off.
Okay. Okay.
Why not?
Yeah, outside.
There was a question right before that happened, and I can't remember what it was now.
You don't want to wider on this.
So looking at the levels.
2B, we were on 2B.
Yeah, we just finished 2B, but I felt like there was a question. Okay. Oh, it's gone.
I know it is.
Oh, what was it?
Do we have 2 years for, oh, yeah.
Yeah, so we
yeah,
have
yeah,
a
that
2-year
was the
period. The question about the implementation of all of this stuff.
So it does take effect July 1, 26.
Right.
But there is that transitional paragraph language that says, you know, recognizing that not all of the elements are going to happen right away. There's a transition time for different elements to start coming online. But it was at least the discussion upstairs that some of these elements and aspects of the program would be ready to go July 1, 26. And that is why the date is selected with that sort of on-ramp period.
Okay. That's okay. I think they were just poking by. Thank you. Yeah.
Okay. So that brings us to level 3, specialized services. And we're gonna write specialized shelter services on line 19 there. To the extent funds are appropriated for this purpose, relevant AHS department shall determine the need for and the extent, to the extent funds permit, which we don't need twice, I'm gonna strike that. Develop specialized shelter services that comply with the fire and building safety code as well as any other applicable standards relevant to the specialty population. The relevant AHS department shall enter into agreements with community partners for the provision of specialized shelter services for a period of not less than 2 years. Do you want that
And that's
updated
the other,
also?
that's the other place. you have to figure that out. So as we're thinking about building safety codes, how do we deal with public health? Department of Health requirements for facilities.
Well, for hotels and motels, they have the lodging rule. I imagine that any shelter standards that are put in place are going to have health and safety, but I don't know that for a fact.
Fire marshal?
The
That's
fire marshal
that's
is public safety.
That's the fire and building safety.
Like safety code.
Okay. Well, something to think about. Would be helpful, to know just that PDH and DOH in some way would be involved in ensuring that these shelters and facilities are appropriate. That in that way, public health standards.
Okay. Subdivision 2, specialized service shelter shall provide services delivered in a highly structured shelter, as well as additional specialty services, such as services for substance use disorder, mental and physical health conditions. Eligible households receiving specialized shelter services shall participate in case management and other services to the extent of the eligible household's ability. Subdivision 3, an eligible household's needs cannot be met if they cannot be met with level 1. And level 2, a specialized service shelter may be utilized if the eligible households requires that specialized service.
Then hold on.
Okay.
2207 is the permanent supportive housing. AHS or any department within the agency shall provide or enter into an agreement for permanent supportive housing that combines long-term community-based rental assistance with voluntary flexible supportive services, such as family supportive housing and other supportive housing services funded in whole or part by Medicaid, if the household and services are eligible for Medicaid. Eligible households receiving permanent supportive housing services shall participate in case management, planning for housing stability and other services to the extent of their ability. If their needs cannot be met in level 1, the household, their needs can't be met in level 1, level 2, level 3, and permanent supportive housing may be utilized to the extent it's available.
So this in no way, this is a question I guess I have overall. Is there a requirement that an individual or family has to go through all these different levels before they get to permanent supportive housing?
I would say that the language is a little bit murky because on the one hand, we have language that says you're going to place the person, the household in the most appropriate place.
Yeah.
And then in each section, we have these paragraphs that say first, is 1, 2, or 3 appropriate? If not, then maybe 4 is most appropriate. So I don't think there's a requirement per se that you
No,
have
but
to
you
go
want to
through everything.
discriminate between what the needs are.
But
So you would do that, say, is it just this level?
Mhm.
How, Commissioner, go ahead.
One thing I think that is important to note is permanent supportive housing is a service that's available to people at every level along the way. So it's not a distinct thing that exists that you can put someone in a shelter. It's services. It's a bunch of services that are available for each level.
So how can we say that without giving people expectations that permanent supportive housing is available to them? Boom. as soon as they get into the application process. I mean, how can we say that eligibility determination for permanent supportive housing can be made at any stage of the individual's
Okay, go back to the purpose and.
go back in the purpose?
Well, that would be, I mean, you could put it there, it wouldn't be binding.
Yeah,
But if you were trying to mechanize this suggestion, it would be removing this level and having another section after the levels about permanent supportive housing that says something along the lines that throughout a household's participation in the program, permanent supportive housing services would be provided, and this is what they look like, this is who would provide them, etc. So it would be pulled sort of out of this continuum model.
oh, why don't we do that? Is there anybody who doesn't like that idea? Oh, good. You don't like the idea?
Oh, no, I didn't.
I thought, I asked a question, is there anyone who doesn't like that idea? And I saw your hand go up.
No,
Oh, don't do that to
no,
me.
I think I was just moving my
No,
around.
no, let's do that. I think that makes a whole lot of sense here. And it, it removes the stigma associated with being homeless. Really eligible. So if it can get you there, that would be great.
Are we removing 2207 completely?
We're removing level 4.
Yeah.
So now the hotels and motels will be level 4. There'll be a new, yes, I'm gonna borrow some language from there, but it will be a new section.
Oh, goody. I like that. Thank you. Okay.
Okay, so now hotels and motels, which will be level 4. We have intent language, that's the intent of the General Assembly to decrease reliance on hotel and motel rooms. However, until sufficient permanent affordable housing or shelter services are available, the use of hotel and motel services shall be permitted.
Yeah.
If a hotel or motel is utilized pursuant to this section, the department shall enter into an agreement with one or more community partners to provide relevant services to eligible households. Permit a population-specific placement to the extent certain populations are not isolated from the wider community served through the program. Propose hotel and motel rates as part of its budget presentation for the General Assembly's consideration. Use only hotel and motel rates established by the General Assembly. Enter into agreements for the use of blocks of hotel and motel rooms and negotiate conditions for use for those blocks, including access provided to case management and other supportive services with space to provide services as negotiated, and ensure that services are not provided pursuant to this section on a night-by-night basis.
Do we have language in here that says to the extent that funds, et cetera, are available?
And it's so often, I would imagine we do, but I'm not seeing it.
Just want to make sure it's in this.
Well, you have it in 5. Yes.
Okay. Thank you.
Okay. So we just went through what the department's responsibilities are. 3 is the household's responsibility. So if a hotel or motel is utilized, the eligible household shall participate in case management services, planning for housing stability and other services to the extent of the eligible household's ability. For hotel or motel use has to comply with the Department of Health lodging establishment rules and the fire and safety code. And then we have this language to the extent funds are appropriated for this purpose. Between April 1 and November 30th of each year, the utilization of hotel and motel rooms pursuant to the section shall be capped at 800 per night.
I have 7 open.
Thank you, 700. I continually say the wrong thing when I read this section.
Looks like it.
What was that number?
It's 700. 700.
Okay,
700 capped rooms.
so no one is in here, so you won't.
I can't be responsible for
We won't
numbers,
tell
apparently.
them.
Oh my goodness. Okay, between December 1 and March 31 of each year, it's 1,000 rooms per night. And then hotel and motel rooms utilized by individuals that are served under the domestic and sexual violence program are not included in these capped amounts.
Do you have a
I
question?
don't have a question, but it is a comment that we've heard from a lot of folks that they have issues with apps.
Yeah, I know the numbers. It's
The number.
hard to put. It's difficult for us to put numbers in. But how are these numbers determined? I guess is the question.
I can answer if you would
Yeah,
like.
please.
So
Yeah.
part of it is when we looked at the different populations and gathered information from a group of providers in the community, tried to figure out how many folks that were homeless would be served in specialized shelters with the new shelters coming online. And we came up with numbers. I don't know if they line exactly with this, but there was some research that went into it. How could we target the populations and ensure that there's space for them in different levels as they're defined in here?
Yeah. So this is going to be an ongoing debate. I know it has been when we negotiated the GA and the budget. It's a big discussion about how many people. I mean, the goal is to reduce the dependency on hotel motel program. Is there any language that we can put in here about the variability of those numbers dependent on what we each year's outcomes? So I don't know if we can do that. We're certainly not looking to have an ever increasing number of homeless people. The goal is to reduce them.
One thing you could do is you already have language that builds in ECF coming each budget cycle to present what the rates would be for hotels and motels. And you could add language there that they can provide a recommendation on the number of capped room nights. And based on that, you could amend this or you could not withstand it in the budget. And you would continue to get an update from DCF every year.
Why don't we do it with the continuing updates from the department based on utilization? And then we can notwithstand in the budget. I don't want to make this an ongoing debate in the budget process. That's not what we want to do. At the same time, we don't want to put a cap on that is either too high or too low. So therein lies the conundrum.
I think you're saying you want it in the annual report. You want us like a utilization.
Yes.
Okay. It might already be there, but well, we're all thinking about it.
Well, just because the cap is high doesn't mean they have needs every room.
No, but it suggests that, we have this endless opportunity.
Right.
So, Brenda, you want to comment?
Yeah, as you know, I'm not a fan of caps, but I will say that I'm particularly concerned about the winter caps. We have seen 3 exposure deaths this year, and those ones make me extra concerned. I think we have to do something to protect people in the winter.
Understood, and understand also that sometimes when we have caps, contingencies appear to help people and with needs. And remember, this is what the state's doing. We also have local folks who are very much in tune with what's needed in the we've seen shelters open up and we've seen people help. So we can do what we can here and predict what we need. We can't do everything. So that's why we have the Homeless Alliance.
So in the report, I'll add a reporting factor, something about the census or the utilization of the hotel and motel rooms during the 2 time periods, and then something about and the amount of unmet need or unserved individuals.
Does that work for the department?
I think so. I'm trying to figure out ways the metrics we could use to get that, but I think we can come up with that.
Okay.
Chad, do you want to comment?
Yeah, Chad Simmons with the Housing and Homelessness Alliance of Vermont. I think what we asked for is to use the data, so coordinated entry data, so using the data that we have available to make those decisions. And so I think removing the cap is a good idea, and I would agree with Brenda, especially during the cold weather months. And then tying that to actual data around
So
available shelter and the need.
understood. I think for the time being, we're not gonna remove the cap. It's something that came to us from the House, been discussed thoroughly. So. Okay.
May I have your attention, please? May I have your attention, please? This is a building evacuation. Gather your belongings if they are within reach and evacuate the building using the designated route for area. Please use the stairwell for exit. Assemble in your designated area for checking fire and life safety.
Do you know where we go? Yeah, and then we go up to the auditorium.
Not really a-
May I have your
I like
attention,
it.
please? May I have your attention, please?